Hi all. Today I am going to discuss a topic on female urology, urinary leak in females. So let's see what is urinary leak or urinary incontinence. There are different types of incontinence, but the patient will say only incontinence. The doctor has to take the proper history and identify what type of incontinence because the treatment is totally different. Usually we see three types of incontinence in females. It can affect from the pediatric age, adult age, middle age and old age. That means no age is bar for this disease. Let's see. First is overactive bladder or urgency wetting. In these patients will have the symptom of increased frequency of micturition. That means they'll have to run to the toilet, again come back, go and come back, night multiple times, waking up, disturbed sleep, everything is problem. It affects both physical and mental health very badly. They can't go to the office, they can't go to the meetings. If a school teacher, she can't take the proper work in the school. So it's a very problematic disease in the society. It's overactive bladder. There will be urgency, there will be wetting, she has to run to the toilet multiple times and recurrent urinary tract infection will add to the problem. Okay. So overactive bladder, the symptom patient will be carrying out for long term. They may be using pad, etc., etc. The commonest cause for the overactive bladder, one thing is urinary infection, which can cause infection of the bladder wall. Second, it is very much related to the food we eat. It can precipitate if we take very hot spicy food. Indian food, we know that it's a masala food. So we like it, we Indians like it, but the spice gets into the urine and irritative symptoms is too much. Likewise, caffeine in too much can cause overactive bladder symptoms. We are in a society where we take social drinking, etc. The alcohol can cause urinary leak, carbonated beverages, etc., etc. So another important thing is that major diseases like tuberculosis, bladder cancer also can have these symptoms. So we have to identify this cause of overactive bladder with a simple test, urine routine, simple blood test and simple ultrasound. That will solve the problem. Second disease, what we call, is the stress urinary incontinence. Here also the patient will tell only urine leak. But if you go into the detail, we will understand that she will be having a stress leak. That means once while laughing, while climbing the stairs, while speaking loudly or coughing, there will be sudden burst of urinary leak. So patient will tell the urine leak, but it's entirely different from the first disease, what it is called overactive bladder. So usually the stress wetting is seen in females who have got multiparous, that means multiple deliveries, patient who has delivered large baby, patient who had a prolonged labor, but after menopause due to hormonal support loss, but also seen in so many youngsters also. Okay. So the basic cause of this stress wetting is the pelvic floor muscle weakness. So how we will treat this? First of all, identify it, do the strengthening exercise like Kegels, etc. Medications will help a lot. If it is not improving, within 15 minutes it can be solved. Just put a TVT or tape. It's a lifelong solution for the problem and it stops, leak stops immediately. So this is another type of wetting which has got 100% treatment. And third group is that mixed incontinence. They will have both the thing, overactive bladder and stress urinary incontinence. So we have to analyze from the history what is it and accordingly we have to treat the patient. So what are the tests for the urine leaks? Generalized, I will say, for all these steps. First one is the history taking is very important. That will give a clue to the diagnosis. Second one, urine routine, blood test and basic ultrasound. It is available every villages in India right now. Okay, just an ultrasound will solve and special tests like uroflow. We have to pass urine in a machine And lastly, we can do a flexible cystoscopy. Just 30 seconds it takes. Checks the light into the bladder. We can assess the bladder, what is the problem, and also we can ask them to cough and demonstrate whether leak is there and proper diagnosis can be made. So this is a commonest problem the female population faces of all age group, and we know that nowadays most of the females are educated and in a working class, and it affects their life both physically and mentally, and some of the people, young adults, are getting aversion to sex because of this urine leak. So it's affecting their quality of life like anything, and this all happens because they don't discuss these simple issues to a urologist. If it is properly discussed and it's diagnosed, it's 100% a solution for it. Thank you.